everybody, guess who's back? It's Dr. Ken Bock, my doctor, and the just most delicious pioneer of functional and integrative medicine, Dr. Bock.
Ooh, you're too sweet.
Welcome back.
Always a pleasure. Chatting true, I'm there.
You're right here. And you know what? We're going to talk about Lyme disease today.
Fantastic.
You are such a pioneer with Lyme disease, and you've been treating so many patients over the years. And we live in the Northeast. I don't know where you live, but in the Northeast, it's a big issue, especially in the Hudson Valley. And so just to step back, what is Lyme's disease?
Lyme disease.
Not plural. It's Lyme. What is Lyme disease?
Lyme disease is actually a multi-system disorder that's basically, it's an infectious disease transmitted by ticks, generally the deer tick. Mm-hmm. And it's a spirochete. It's basically like very similar, like remember syphilis in the old days, that was a spirochete. It's a spiral-shaped bacteria. Well, this is its own type of spirochete. It's called a Borrelia. And if you look at it, it's like this little spiral. It's pretty weird if you look at it in the tissues. And it's a bacteria, it's very slow growing, and it wreaks havoc. It's not like strep, where like a strep throat will multiply every 20 minutes. This is a bacteria that maybe will multiply every 28 days. It's very, very slow. And so it's very hard to kill, and unless you get it early. And so let's say you're out in the woods, you're in the Hudson Valley, which is one of the endemic places, but you know, you're on the Jersey Shore, you're on Long Island. It's really in every state in the country, and it's really all over the world now, although sometimes people think it's not there. And it can, when you get bit by the tick and the bacteria gets inside your system, first thing you do is cause a rash, bullseye rash. The
circle.
The circle with kind of a clear center. That's very obvious, and you don't even need a blood test to confirm that when you see it, and you know there's a tick bite and you have to treat that. But then that will go away even without treatment eventually, usually within days to a number of weeks. And then you get another stage where and in that first stage you can get the chills, looks like a flu. So if you get a flu in the summer sometimes or the spring when there's no flu season, you gotta start thinking about Lyme. Muscle aches, joint aches, headaches, neck ache.
And that's when you should really be checking yourself. You come in from a hike, or even, I have to say, I'm just walking down my yard and I've had 2 ticks on me, or especially if you have an animal, right?
If you have a dog. The one problem with Lyme disease is that we call it the great imitator. Actually, syphilis was called the great masquerader way back, in the earlier 1900s. And Lyme really is that right now. I mean, because it can you can have symptoms ranging from fatigue, headache, neck ache, other joint aches, neurological symptoms where brain fog, cognitive dysfunction, you can't retrieve words, your memory is not there. And I've seen some really smart people not look so smart with Lyme disease.
Now, what if they don't find the red bullseye? Does that mean you're always going to see a red bullseye?
Less than half the time you'll see the red bullseye. Less than half the time you'll hear about a tick bite. That's what's so ornery about this disorder or disease. It's easy when you've had a tick bite and you get what we call an erythema migrans, a Lyme rash, like a bullseye. The problem with Lyme is that it can cause this myriad of symptom complex, and it's not easy to diagnose because the tests are not 100% accurate.
That's what I wanted to ask you. What tests should people get if they're concerned?
Well, you want to get a Lyme titer and a Western blot. We're frequently told in conventional medicine to just get the Lyme titer. If it's positive, get the Western blot. But we see a lot of normal titers with positive Western blots. And some of the labs out there don't do a great job, the more just generic labs that do a lot of other testing. So we do send it to special labs that specialize in Lyme, and they will pick up Lyme when others won't. And so it's really important. And the one thing to realize, which is very hard for doctors to accept, it's a clinical diagnosis. Like this person who comes to me today, I mean, there's not that many things that give you this whole assortment of fatigue, weakness, disequilibrium, cognitive dysfunction, joint aches, muscle aches, feet pain. And you've had a tick bite, and your dog has had ticks, and the dog sleeps in your bed. I mean,
that's kind of a grand slam as Lyme.
Got it. So
Now, what can we do if we've been diagnosed with Lyme?
Well, you know, I know a lot of your listeners are vegans and they're more naturally oriented, but I would really say this is a disorder that needs to be treated with antibiotics because if you get it early, you can really get it.
We're not against meds.
No, good.
We're definitely not against meds when we need them because that's when we have to come together. There's both worlds, right? So antibiotics.
That's why I love integrative.
Yes,
and
exactly.
integrative is the whole lifestyle. It's supplements, but it's also medications when needed. So, yeah, you need antibiotics. And again, one of the keys is to be able to treat long enough and hard enough, and using adequate doses, which are a little higher than usual, and also enough time. Sometimes doctors will treat Lyme for 10 days or 2 weeks. For me, that's not enough because, you know, I'm from a camp that believes you need to treat longer. And that there is something called chronic Lyme. I mean, there are actually doctors who will say that there is no chronic Lyme. You treat a few weeks and it's done. And
but patients are still feeling like garbage.
Well, it's post-Lyme. It's post-Lyme, but they don't have Lyme. And you know, we've helped a lot of those patients, but it means to be a little more aggressive in terms of the antibiotics. And one of the keys in terms of being integrative is to make sure we protect the other organs. So we protect the liver with herbs like silymarin, maybe NAC, combinations with dandelion or what have you, phosphorylcholine perhaps, but you also protect the gut with really high-dose probiotics, really good, we've talked about this in others, high-quality probiotics, and sometimes even Saccharomyces boulardii, which is a kind of a probiotic yeast to prevent the diarrhea that comes with antibiotics sometimes. So we can not only treat the illness, but part of what I think is our responsibility is to protect the other organs. Very, very important.
And so lastly, I want to ask you, if somebody is facing more of a chronic Lyme, as you say, or a long-term situation, or maybe they've had it for so long, you're not catching it early,
right?
Do they have hope?
Yes, they have hope. They have to recognize that it may be a long course, and it's not easy, and it may involve oral antibiotics, it may involve IV antibiotics, and it's tough. If you have Lyme disease, find somebody who we say is Lyme literate, who knows how to treat Lyme disease, because you don't want to be undertreated in this disease. You really don't.
Thank you so much for coming back. You're such a wealth of information for us. And guys, if you want to know more, it's bockintegrative.com. You can check it out below. And I hope this helps you. If you have any questions about Lyme, you can certainly leave them here. And if we can answer them in any way, we will. And oftentimes what happens in the comments is somebody else has a great lead. Somebody else has something that has helped them. And we love to create that community. So again, thanks, Dr. Bock.
You're welcome, Kris. Always a pleasure.
And thank you. See you next time.